Have you ever felt like there's always something stuck in your throat? You clear your throat over and over again. You swallow repeatedly. Sometimes you cough, but nothing really comes out. Many people assume it's just a cold or seasonal allergies. But what if the real reason is something completely different? Today, we're uncovering 5 medically recognized reasons why mucus seems to stay in your throat, and what your body may be trying to tell you. Some of these causes are surprisingly common, while others deserve medical attention if they continue. This information is based on general medical knowledge, and is meant for education only. It should never replace advice from your healthcare professional. Let's begin. Most people are surprised to learn that the presence of mucus in the throat is not a sign that something is wrong. In fact, mucus is one of the body's most important natural defense systems, and without it, your nose, throat, and airways would struggle to function properly. Every single day, your body quietly produces a significant amount of mucus, even when you feel perfectly healthy. For most adults, this can range from about 1 to 2 liters over the course of a day. The reason you rarely notice it is because your body has an incredibly efficient cleaning system. Tiny hair-like structures called cilia constantly move this thin layer of mucus toward the back of the throat, where it is swallowed automatically without you ever realizing it. It is a completely normal and continuous process that helps keep your respiratory system clean. Think of mucus as your body's natural security guard. Every breath you take brings tiny particles into your airways. Dust, pollen, smoke, bacteria, viruses, and other microscopic irritants are constantly floating in the air around us. As these particles enter your nose and throat, mucus acts like a sticky trap, capturing them before they can travel deeper into your lungs. Once trapped, the cilia gently transport the mucus away, so these unwanted substances can be swallowed and safely broken down by the digestive system. This remarkable process happens thousands of times every day, without requiring any effort from you. Mucus also serves another essential purpose. It keeps the delicate lining of your nose, throat, and airways moist. The tissues inside your respiratory tract are sensitive and can easily become irritated if they dry out. A healthy layer of mucus provides constant lubrication, making it easier to breathe, speak, swallow, and protect the airway from damage. Without enough moisture, these tissues can become inflamed, leading to discomfort and making it easier for germs to cause infections. In other words, mucus is not your enemy. It is actually working around the clock to protect your health. So why do some people constantly feel mucus in their throat while others hardly notice it? In many cases, the problem isn't that the body is producing too much mucus. Instead, the mucus may become thicker, stickier, or more noticeable because of changes in your environment or health. Dry air, dehydration, allergies, viral infections, sinus irritation, or exposure to cigarette smoke can all change the consistency of mucus. Rather than flowing smoothly, it may begin to cling to the back of the throat, creating the sensation that something is stuck. This often leads people to repeatedly clear their throat, but frequent throat clearing can actually irritate the throat further, creating a cycle where the sensation becomes even more noticeable. It's also important to understand that everyone's mucus production can vary slightly from day to day. During allergy season, after a common cold, or when you're exposed to pollution or strong odors, your body may temporarily produce more mucus as a protective response. This doesn't necessarily mean there is a serious medical problem. It's simply your immune system doing its job by trying to remove irritants before they can cause harm. The key takeaway is this: mucus itself is completely normal and necessary for good health. Your body depends on it every hour of every day to filter the air you breathe, defend against harmful germs, and keep your respiratory system functioning smoothly. The real concern is not the presence of mucus, but when it becomes unusually thick, excessive, persistent, or is accompanied by symptoms such as difficulty swallowing, persistent hoarseness, fever, unexplained weight loss, or coughing up blood. If those symptoms occur or the sensation continues for an extended period, despite simple self-care measures, it's wise to seek medical evaluation to identify the underlying cause. Understanding that mucus is a natural protector, not simply an inconvenience, is the first step toward understanding why your throat feels the way it does. One of the most common reasons people constantly feel mucus in their throat doesn't actually begin in the throat at all. It often starts much higher, inside the nose and sinuses. This condition is known as postnasal drip, and it's something healthcare professionals see every day. Although the name may sound complicated, the process is actually quite simple. Your nose and sinus passages naturally produce mucus around the clock. Under normal circumstances, this mucus is thin, clear, and quietly flows down the back of your throat, where it is swallowed without you ever noticing it. In fact, this happens hundreds of times every day and is an important part of keeping your airways clean and healthy. Problems begin when your body starts producing more mucus than usual, or when that mucus becomes thicker than normal. Instead of moving smoothly, it begins to collect along the back of the throat. As it builds up, you may develop the uncomfortable feeling that something is constantly stuck there. Many people respond by repeatedly clearing their throat, coughing lightly, or swallowing over and over again, hoping to remove the sensation. Unfortunately, frequent throat clearing can irritate the delicate tissues of the throat, making the sensation even stronger. This creates a frustrating cycle where the more you clear your throat, the more irritated it becomes, and the more you feel the need to clear it again. There are several reasons why postnasal drip may develop. One of the most common is seasonal allergies. During certain times of the year, pollen from trees, grasses, or weeds can trigger your immune system to produce extra mucus in an attempt to trap these tiny particles before they reach your lungs. Dust mites, pet dander, mold spores, and other indoor allergens can have a similar effect throughout the year. Viral infections, such as the common cold, are another frequent cause. During a cold, your body increases mucus production to help capture viruses and flush them out of your respiratory system. Even after other cold symptoms improve, excess mucus may linger for several days or even weeks before gradually returning to normal. Environmental factors also play an important role. Dry indoor air, exposure to cigarette smoke, strong perfumes, cleaning chemicals, air pollution, and sudden changes in temperature can all irritate the lining of the nose. When this irritation occurs, the body may respond by producing additional mucus as a protective mechanism. For some individuals, spicy foods or changes in weather can temporarily increase nasal secretions as well. These reactions are not necessarily signs of disease. They are simply examples of how sensitive the respiratory system can be to its surroundings. Many people mistakenly believe the mucus they feel is being produced directly in their throat. In reality, the throat is often only the place where the drainage becomes noticeable. This is why treating the throat alone may not solve the problem if the true source is the nose or sinuses. Paying attention to nasal symptoms such as congestion, sneezing, itchy eyes, or a runny nose may provide important clues about what's really causing the discomfort. Simple self-care measures may help reduce postnasal drip for some people. Staying well hydrated can help keep mucus thinner and easier to clear naturally. Using a cool mist humidifier during dry seasons may add moisture to the air and reduce irritation. Limiting exposure to known allergens or environmental irritants, when possible, may also decrease excess mucus production. Some people find that gently rinsing the nasal passages with sterile saline solutions, following proper instructions, helps remove irritants and improve comfort. However, not every treatment is appropriate for every person, and persistent symptoms should always be evaluated by a healthcare professional. It's also important to know when postnasal drip may require further medical attention. If the sensation lasts for several weeks, keeps returning, interferes with sleep, causes significant coughing, is associated with severe facial pain, fever, difficulty swallowing, or produces mucus that contains blood, it's important not to ignore these warning signs. These symptoms do not automatically indicate a serious condition, but they do deserve proper medical evaluation to determine the underlying cause. The most important message to remember is that postnasal drip is extremely common and, in many cases, manageable once the underlying trigger is identified. Rather than focusing only on the throat, understanding that the nose and sinuses are often responsible, can help explain why that persistent feeling of mucus doesn't seem to go away. By identifying the cause and seeking appropriate medical advice when necessary, many people are able to find lasting relief and reduce the constant urge to clear their throat. Another often overlooked reason for persistent mucus in the throat has nothing to do with your nose or your lungs. Instead, it may begin in your stomach. Many people are familiar with acid reflux because of the burning sensation in the chest, commonly known as heartburn. However, what surprises both patients and even some caregivers is that acid reflux doesn't always cause heartburn. In some individuals, stomach contents travel upward and reach the throat without producing the classic burning pain. This is often referred to as silent reflux because the usual warning signs may be absent. As a result, many people spend months trying to treat what they think is a throat problem, when the real issue is occurring much lower in the digestive system. To understand why this happens, it helps to know how the digestive system normally works. After you swallow food, it travels down the esophagus and enters the stomach through a ring of muscle called the lower esophageal sphincter. This muscular valve is designed to close after food passes through, helping keep stomach contents where they belong. The stomach naturally produces acid to help digest food, and under normal conditions, this acid stays safely inside the stomach. However, if the valve relaxes at the wrong time or doesn't close completely, small amounts of stomach acid and digestive fluids can move back upward. When these contents reach the upper throat or voice box, even tiny amounts can irritate the delicate tissues. Because they are not designed to handle stomach acid, the body's response to this irritation is often protective rather than harmful. One of the ways it tries to shield the throat is by producing additional mucus. This mucus acts like a natural coating, attempting to reduce irritation and protect the sensitive lining. Unfortunately, while this protective response is helpful, it can also leave you with the constant sensation that mucus is stuck in your throat. Many people find themselves clearing their throat repeatedly throughout the day, swallowing frequently, or coughing, even though they don't have a cold. In reality, the excess mucus may simply be the body's attempt to defend itself from repeated exposure to stomach contents. Silent reflux can produce a variety of symptoms that don't immediately suggest a digestive problem. Some people notice persistent throat clearing, while others experience a hoarse or raspy voice, especially in the morning. A dry cough that lingers for weeks, the feeling of a lump in the throat, frequent swallowing, or the sensation that food moves slowly when swallowing are also commonly reported. Because these symptoms overlap with allergies, postnasal drip, or minor throat irritation, silent reflux is sometimes overlooked until a healthcare professional considers the possibility during a medical evaluation. Certain habits and lifestyle factors may increase the likelihood of reflux in some individuals. Eating very large meals can place additional pressure on the stomach, making it easier for stomach contents to move upward. Lying down immediately after eating may also allow acid to travel toward the throat more easily, because gravity is no longer helping keep it in the stomach. Foods that are spicy, fatty, or highly acidic, as well as chocolate, peppermint, caffeinated beverages, and carbonated drinks, may trigger symptoms in some people, although not everyone is affected in the same way. Smoking, excessive alcohol consumption, and carrying excess body weight are additional factors that may contribute to reflux for certain individuals. It's important to remember that triggers vary widely, and what causes symptoms for one person may not affect another. Simple lifestyle adjustments may help some people reduce reflux-related symptoms. Eating smaller meals, avoiding heavy meals close to bedtime, remaining upright for a period after eating, and maintaining a healthy weight, when appropriate, are commonly recommended approaches. Some individuals also benefit from identifying foods that seem to worsen their symptoms and discussing those observations with their healthcare provider. However, persistent symptoms should never be self-diagnosed, as throat irritation can have many different causes that require different treatments. It's equally important to recognize when professional medical evaluation is necessary. If throat mucus, hoarseness, chronic coughing, or swallowing difficulties continue despite healthy lifestyle changes, or if symptoms become more frequent or severe, a healthcare professional can help determine whether reflux or another condition is responsible. Prompt evaluation is especially important if symptoms are accompanied by unexplained weight loss, persistent pain, vomiting blood, black stools, or increasing difficulty swallowing. These warning signs do not automatically indicate a serious illness, but they should always be assessed without delay. The most important lesson is that persistent mucus in the throat isn't always caused by allergies or sinus problems. Sometimes, the throat is simply responding to irritation coming from the digestive system. By understanding that stomach acid can affect areas far beyond the stomach itself, people are often better prepared to recognize patterns in their symptoms and seek appropriate medical guidance. Identifying the true source of the irritation is the first step toward finding effective treatment and reducing that frustrating feeling of constantly needing to clear your throat. Sometimes the sensation of mucus constantly sitting in your throat has very little to do with how much mucus your body is producing. Instead, the real issue may be the consistency of the mucus itself. Healthy mucus is normally thin, slippery, and easy for the tiny hair-like structures in your airways, called cilia, to move toward the throat where it can be swallowed without you even noticing. However, when your body loses moisture or the air around you becomes too dry, that mucus can become thicker, stickier, and much more difficult to clear. Even if your body is producing the same amount of mucus as always, thicker mucus is far more noticeable and can leave you with the uncomfortable feeling that something is constantly stuck in your throat. Water plays a critical role in maintaining the right balance. Every cell in your body depends on adequate hydration, and the cells lining your nose, throat, and respiratory tract are no exception. When you're well hydrated, mucus contains enough water to remain thin and mobile. It flows smoothly over the tissues, traps unwanted particles, and is removed naturally by the body's cleaning system. But when you don't drink enough fluids, the water content of mucus can decrease, causing it to become more concentrated and sticky. Imagine the difference between fresh syrup and syrup that's been left uncovered for hours. As moisture evaporates, the remaining liquid becomes much thicker. A similar process can occur with mucus inside the airways. Dehydration doesn't always happen because someone forgets to drink water. It can develop gradually for many different reasons. Spending time outdoors in hot weather, exercising intensely without replacing lost fluids, having a fever, or experiencing vomiting or diarrhea can all reduce the body's water supply. Even everyday habits, such as drinking large amounts of caffeinated beverages or alcohol, may contribute to dehydration in some individuals, because these drinks can increase fluid loss in certain circumstances. Older adults may also be more vulnerable because the natural sensation of thirst often becomes less noticeable with age, making it easier to drink less than the body actually needs. The environment around you can have just as much influence as the amount of water you drink. During the winter months, indoor heating systems often reduce humidity levels, creating very dry air inside homes and workplaces. Air conditioning during the summer can have a similar effect by removing moisture from the air. Long airplane flights are another common example, as cabin air is typically much drier than normal outdoor air. When you spend several hours breathing dry air, moisture can gradually evaporate from the lining of your nose and throat. In response, the mucus may become thicker, making it feel more difficult to swallow or clear naturally. Another common contributor is sleeping with your mouth open. People who snore, have chronic nasal congestion, or sleep with certain breathing patterns may unknowingly breathe through their mouth for much of the night. Unlike the nose, which helps warm, filter, and humidify incoming air, the mouth provides much less moisture. As a result, the throat can become dry by morning, leaving thick mucus behind and creating the urge to clear the throat shortly after waking up. Many people mistakenly assume they are getting sick when, in reality, they are simply experiencing the effects of overnight dryness. It's also important to understand that repeatedly clearing your throat may actually make the problem worse. Although it may provide temporary relief, frequent throat clearing can irritate the sensitive tissues of the throat. Irritated tissues may become inflamed, making the throat feel even more uncomfortable and increasing awareness of the mucus that's already present. Over time, this can develop into a cycle where dryness leads to thick mucus leads to throat clearing, and throat clearing creates additional irritation that makes the sensation persist. Fortunately, simple daily habits may help support healthy mucus consistency for many people. Drinking enough water throughout the day is one of the most effective ways to help maintain normal mucus thickness. While fluid needs vary depending on age, activity level, climate, and overall health, staying adequately hydrated supports many important functions throughout the body, including the respiratory system. Some people also find that using a cool mist humidifier during particularly dry seasons helps add moisture back into the air, making breathing more comfortable. If a humidifier is used, following the manufacturer's cleaning instructions is important to help prevent the growth of mold or bacteria inside the device. Keeping nasal passages healthy may also be beneficial. Gentle saline nasal sprays or sterile saline rinses, when used according to instructions, can help moisturize the lining of the nose and wash away irritating particles. Avoiding cigarette smoke and limiting exposure to air pollutants whenever possible may also reduce irritation that contributes to thicker mucus. For people who spend long hours in air-conditioned offices or heated indoor environments, taking occasional breaks, drinking water regularly, and maintaining comfortable indoor humidity may make a noticeable difference. The key message is that thick mucus doesn't always mean your body is producing too much of it. Often, it's simply a sign that the mucus has lost some of its moisture and become more noticeable. By supporting proper hydration, reducing exposure to excessively dry air, and protecting the natural moisture of your airways, many people find that mucus becomes easier to clear and the constant sensation in the throat gradually improves. However, if thick mucus persists despite these measures, or is accompanied by concerning symptoms such as fever, severe pain, difficulty breathing, or coughing up blood, a medical evaluation is important to identify any underlying condition that may require treatment. While persistent mucus in the throat is most often linked to common and manageable conditions, there are times when it deserves closer medical attention. One of the most important things to understand is that your body often communicates through symptoms long before a condition is diagnosed. A sensation that lasts for a day or two during a cold is usually very different from mucus that continues for several weeks without improvement. Paying attention to how long the symptom lasts, whether it changes over time, and whether other symptoms appear alongside it, can provide valuable information for both you and your healthcare professional. Many people become accustomed to clearing their throat every few minutes and eventually accept it as part of daily life. They may assume it's simply due to aging, allergies, or the weather, and they delay seeking medical advice because the symptom doesn't seem severe. However, persistent throat mucus should never be ignored if it continues, despite staying hydrated, managing allergies, or making reasonable lifestyle adjustments. Although the cause is often something straightforward, only a proper medical evaluation can determine the exact reason when symptoms become chronic. A healthcare professional will usually begin by asking detailed questions about your symptoms. They may ask when the mucus first appeared, whether it's worse in the morning or after meals, if you have nasal congestion, coughing, heartburn, hoarseness, or difficulty swallowing. These questions help narrow down the possible causes because mucus in the throat can originate from several different body systems, including the nose, sinuses, digestive tract, lungs, or throat itself. Understanding the complete picture often makes it easier to identify the underlying issue, depending on your symptoms. A physical examination may be followed by additional testing if appropriate. For some individuals, the examination alone provides enough information to suggest allergies or postnasal drip. Others may benefit from an evaluation of the throat by an ear, nose, and throat specialist, allergy testing, imaging of the sinuses, or tests that help assess digestive conditions such as reflux. It's important to remember that not everyone with throat mucus needs extensive testing. Healthcare professionals recommend additional evaluations only when symptoms, medical history, or examination findings suggest they may be helpful. There are also certain warning signs that should never be ignored. If you experience difficulty swallowing that continues or worsens, pain when swallowing, persistent hoarseness lasting several weeks, unexplained weight loss, coughing up blood, mucus mixed with blood, chest pain, persistent fever, severe shortness of breath, or swelling in the neck, it's important to seek medical evaluation promptly. These symptoms do not automatically indicate a serious illness, but they require timely assessment because they may be associated with conditions that need specific treatment. Early evaluation often allows healthcare professionals to identify problems sooner, when management may be simpler and more effective. Another point worth mentioning is that self-diagnosis can sometimes delay appropriate care. The internet contains a great deal of health information, but symptoms such as throat mucus can have many different causes that produce very similar sensations. One person may have allergies, another may have silent reflux, while someone else may simply be dealing with dry air or dehydration. Taking medications or supplements without knowing the actual cause may not improve symptoms, and, in some situations, could even create unnecessary side effects. This is why professional guidance becomes especially valuable when symptoms persist or become more bothersome over time. Lifestyle also plays an important role in long-term throat health. Avoiding tobacco smoke, limiting exposure to environmental pollutants whenever possible, staying physically active, maintaining good hydration, getting enough sleep, and following a balanced diet all help support the body's natural defense systems. These healthy habits cannot prevent every medical condition, but they contribute to the normal function of the respiratory and digestive systems, and may reduce irritation that contributes to ongoing throat discomfort. It's equally important to remember that every person's body is different. What resolves symptoms for one individual may not have the same effect for another. Some people improve by treating seasonal allergies, while others experience relief after addressing acid reflux or improving indoor humidity. Rather than searching for a single solution that works for everyone, the goal is to identify the specific factor responsible for your symptoms. This personalized approach is one of the reasons medical evaluation can be so valuable when throat mucus becomes persistent. The reassuring news is that, in the majority of cases, ongoing mucus in the throat is not caused by a serious disease. Conditions such as postnasal drip, allergies, viral infections, dry air, dehydration, and reflux are far more common explanations. Nevertheless, listening to your body's signals is one of the smartest steps you can take for your health. Persistent symptoms should never be dismissed simply because they seem minor. Seeking medical advice when symptoms last longer than expected, become more severe, or are accompanied by warning signs, allows healthcare professionals to identify the underlying cause and recommend the most appropriate treatment. Staying informed, paying attention to changes in your body, and acting promptly when something doesn't seem right are all important parts of protecting your long-term health. The next time you find yourself clearing your throat over and over again, remember, your body may be sending an important message. In many cases, the cause is something common, such as postnasal drip, silent acid reflux, dry air, or natural changes in mucus production. Understanding the possible reasons is the first step toward having a more informed conversation with a healthcare professional. If you found today's discussion helpful, consider sharing it with family and friends who frequently struggle with throat mucus, but aren't sure why. And if you'd like to learn more about healthy aging, everyday medical questions, and practical wellness tips explained in clear, easy-to-understand language, be sure to join us for future videos. Until next time, take care of yourself, stay informed, and make your health a priority.